Welcome and thank you for joining this special edition of our healthcare series. Last week, we had the privilege of being with a bunch of customers at Red Hat Summit 2025 in Boston, and we wanted to come and share some of the tips and trends and actions that you can take to use what came out with new technologies last week in your organization. So let's jump right in. Vince and Atif, what were some of the most surprising trends and new technology announcements that you saw last week that can benefit our healthcare customers?
So the big one I saw for healthcare was VLLM, which is a very technical product announcement, but it leads us to something like Red Hat Inference Server that lets us run large language models efficiently in private data centers that can be trained on companies' domain-specific information. That's very important in the healthcare space where we're dealing with people's health information, and we want to keep it to the highest possible security standards.
Yeah, that enables some of the use cases like processing MRI or CT images. We have previously brought CHRIS project, Boston Children's Hospital open source project, to the Red Hat Summit stage as well. That actually builds on this concept. Now we have made it available throughout the whole larger ecosystem. So allowing customers to run a compressed LLM to drive new use cases such as claims automations, prior authorizations.
Great. Vince, I had a privilege of sitting in on one of the sessions with you, a roundtable with some customers where we really dove into AI. Can you share some real world examples?
So I think one of the coolest things I've seen is looking at somebody's medical history and planning out like a statistical future trajectory. For example, people with cholesterol readings that have changed a certain way over time combined with 20 other factors, right, have like a 90% chance of heart attack within a period of time. So knowing that, right, we can get proactive and more aggressive, and we can even spend more on preventative measures. So that both improves health and is better for reducing long-term costs of medical care. So we always did some of that statistically, but it's opening up so many more conditions and a ton more data to improve accuracy. It's not a Gen AI problem, but it's a great application of machine learning. On the operational side, we've seen large interest in minimizing delays in prior auth, like Atif said, right? So one example, we've seen it cut average time from 135 minutes to 10. Generally, it's a pretty big win anytime you can find ways to reduce overhead activity.
Down to 10 minutes, that seems impressive. A lot of time saving, probably a lot of frustration saving. How about you, Atif? What were you seeing?
Yeah, so actually, 82% of the physician complain about prior authorization as the root cause of their burnout. So it is huge, right? And it's on the payer side and the provider side. And as a member or a patient, you are the one who is suffering while waiting for the prior authorization. In addition to that, there have been a number of use cases that you wouldn't think about commonly, but the people are using Gen AI to do that, such as doing data transformation. Every healthcare data feed, they had typically do hard mapping to it and has a rule base. And it's hard and brittle to manage. As you add new data feeds, it's now another integration point that you have to do. So folks are actually using Gen AI to see if they can automate onboarding of new data feeds and reducing some of the technical debt in managing some of that through rule-based approach to moving to more Gen AI-based approach. I thought that was very novel. Last but not least, medical industry or healthcare industry is plagued with PDFs and documents, right? Extraction of that information and making that meaningful and be able to compute on it. So on Red Hat Stage, we had unstructured IO that actually does exactly that. And we did that with unstructured IO at one of the largest blues to extract PDFs that were coming in through fax and then making it part of the decision-making process in either processing claims or prior auth as well.
Great. Now, for organizations who are getting started in some of these new technologies, we talked a lot about Red Hat AI at Summit, virtualization, automation, all of the great things that we've got here. But what are the first couple of steps that they should take?
Well, the first step is always putting in effort to learn something, right? So if you went to Red Hat Summit, watched any of the recording sessions, or even if you're watching this, right, you're taking a step to learn. And certainly there's always more to learn. That's a continuous goal. But the goal, right, is to find out what is possible with new technology, or what will soon be possible with emerging technology. After that, right, you always want to have some problem to solve that's tactical within your company or the world more broadly, right? You need to have an understanding of the problem and the constraints on solving it, right? Like data security, privacy, and then it's actually, using new technology to solve that problem and iterating until you've really made something impactful.
How about you, Atif?
Yeah, so from my perspective, I would say actually start with the business first. Understand the business that you are trying to automate or leverage these technologies for, even virtualization, and then build a very clear business case, what the cost savings, projected ROI is going to be. That will allow you to onboard your stakeholders that this is a critical project and ensuring that it doesn't just stay in the ideation phase, but sees the production phase as well.
That is a good tip. I remember when we launched automation and really got into the Ansible world, that was one of the big things that we had to remind folks of too. You can automate a bad process, but you still have a bad process. So let's evaluate what we're doing first so we don't just do something wrong faster.
That's correct. That's correct.
All right, beyond the technology, what are some of the key strategic trends that you saw coming out of Summit?
Well, first, I'd say nothing ever grows less complex over time, right? As we're charging towards AI and agents, knee-jerk reaction is that we can use these technologies to reduce staff, right, to cut costs. And it's true that these tools can increase productivity in software development and other areas, but that creates a tremendous opportunity for using that increased capacity for something good, right? If you had twice the IT team, right, you could modernize your applications to reduce risk. You could build new products at the same time. So think of that as the other side of staff cutting, right? Using that capacity.
Yeah, from my perspective, this summit was all about delivering on our CEO Matt Hicks' vision of democratizing AI. Doing the same that we did for Linux, now we're doing it for AI. And inference server and other partnership announcement with NVIDIA, Google, you name it, with IBM, is all about making those choices available to our end customers and allowing them to position themselves for a very disruptive industry, which is changing every 4.5 months. And delivering on that promise and bringing those open source principles to those promises, what I think is the most strategic thing that I saw coming out. And in addition to that, our customers that are looking towards modernizing their VMware state and moving to the cloud, that has been a huge booster where other customers have shared their success stories with them and how and what they had to do to be successful in that was another big one for me.
If I'm sitting in a healthcare firm's leadership position, I'm thinking through a few things, right? AI, as you mentioned, what are the impacts on staff? If I have the budget to keep all of my staff, how can I better use them in ways that they can add better results for our customers and patients and physicians and insurance in general? As you go into that, though, you also have to look at the other side of it. What are some common pitfalls and challenges that I'm going to be facing with? So as we look at that, and as you're talking to these leaders of these healthcare organizations, what do you suggest to them? How can they avoid some of these? What are some of the challenges? And then how can they avoid them?
Wow, I think this is something we could spend a lot of time on. I'd say that the biggest thing is to get the incentives right. So any industry like healthcare, right, that deals with sensitive information has a really strong incentive to treat that information appropriately. That instinct can be so strong that it prevents us from taking risk on new things. And the flip side is that we can incentivize innovation projects to the point where we create unacceptable risk for the business, right? So finding ways to securely enable innovation, like creating self-service platforms with security implementing best practices, create sandbox where people can experiment safely, really without risk to explosive bills or impacts to operational systems, right? These are some of the core drivers behind what we've been doing with OpenShift for a long time. And that need is really only growing stronger.
Yeah, from my perspective, this is a common thread that people fear about job elimination. But reality is in healthcare, there is more work than there are people. That is true from radiologists to all the way to the administrative staff. And AI is only going to help improve our productivity and efficiency, which means now we can tend to more customers or patients in our case, or members in our case, increasing the revenues for the organization. So it will come with its challenges because it's going to involve cultural change, letting go of some things that we think is job security, but it's not, because now it's getting automated, but helping folks move up the value chain and taking on the next value added task that really makes a meaningful impact on the organization.
Great. Thank you guys for joining me today and for sharing some of your experiences at Summit. One of the greatest learnings that I walked away with from one of the customer sessions was that so many are looking to AI to be this golden egg, solving all problems. And what's the one thing that can change it all? And what we really learned by listening to all these customers and in talking with folks is that it's a lot of smaller changes that AI and automation can bring that add up to that golden egg and allow for meaningful change. And so that was kind of one of my favorite takeaways. Do either of you have a favorite takeaway that you experienced during your time at Summit?
Well, I think it's very early still in terms of AI for organizations. So the biggest thing I think we see right now is a lot of excitement, a lot of experimentation, and a lot of possibility. And that's something that we love meeting customers with and trying to help them through.
For me, the key takeaway, to paraphrase one of the customers, is this is a chance for them to validate what they're doing by seeing Red Hat making a move in that direction, and other customers are implementing the same capabilities. So that was the biggest takeaway for me, that Summit allows them to validate what they are already doing, but also in listening to other industries and customers and how they're approaching it.
Fantastic. Again, thank you for joining us. Catch us on our healthcare series. We have new episodes launching about every month. So we look forward to having you on future episodes, and let us know if we can help.